disorder that's not often spoken about, but one South Florida family is hoping to change that. Christy Kruger is here with today's HealthCast.
You know, it's hard to know exactly what you would do if you were faced with a really tough situation involving your child. Well, one South Florida family struggling with a rare genetic syndrome is hoping their fight can lead to better treatments and give hope to other families. Parenting 3 young children is a hectic job for any couple, but Missy and Dan Longman have another challenge. Their oldest, Sienna, was born with a rare genetic disorder called Smith-Magenis syndrome. Sienna was diagnosed when she was hospitalized with a heart murmur at just 4 weeks old.
I was devastated, completely devastated. It took me a long time to recover. I mean, everything that we read about it was just so awful and so scary.
Smith-Magenis syndrome is a genetic disorder that leads to developmental delays, learning disabilities, significant sleep disorder, behavioral problems, as well as physical changes.
They can have a small head, a flat face, but they are subtle features. I personally see patients, and I would think of Smith-Magenis when I see a patient who is very aggressive and self-mutilation type behaviors.
The potential for self-injury and aggression is what scares Missy the most.
Fortunately, so far, it's less, but you know, we have a long journey ahead, so I don't know what it's going to look like when she's 15, 16 years old.
Most frustrating for Missy and her husband is the lack of information about the disorder.
There was no, here, if you do this and this and this, your child's going to be okay. You know, it was like, what do you do? Nobody knows.
With the help of another couple in Connecticut, the Longmans started a foundation to raise funding for research into Smith-Magenis. So far, they've provided more than $250,000 in grants, money they hope will help Sienna and so many others.
I fully believe that she's going to write her own story, and we're here to support her to do that.
And we have much more at local10.com. And because you can't change your genes, the treatments for Smith-Magenis focus on addressing symptoms with physical therapy, occupational therapy, speech therapy, as well as medication if needed for the sleep and the behavioral problems. Victor?